This systems report overview brought to you by the Water Services Authority, Taumata Arowai, having a look at our drinking water regulation report and network environmental performance report that were released the week before last. It's really gratifying to see so many people have signed on for this and are already joining this lunchtime webinar. Up until last year, I was a receiver of these reports, and I can say now, being on the inside watching them get produced, they are a huge amount of work for so many of the people involved at Taumata Arowai. So it's really great to see so many of you taking the time today to come and learn a bit more about what they are, how we get to them, and what they mean. But I will start us off with karakia. Sorry, I haven't introduced myself. My name's Tim Cadogan. If we haven't met before, I'm an engagement specialist here at the Water Services Authority. So karakia, kia hora te marino, kia whakapapa punamu te moana, hei hora rahi mā tātou e te rangi nei. Aroha atu aroha mai, tātou ia tātou katoa, hui e taiki e. Just a little bit of housekeeping. What we're going to do is take questions as we go in the Q&A, please. I think the chat has been disabled and mics have been disabled, but we really do welcome questions from you. What we'll do is we're starting off with the Network Environmental Performance Report, and once we've gone through the slides in relation to that, we'll pause then and we'll take questions, because one would imagine that they will be the relevant questions. And then we'll go to the drinking water report and take any questions after that on either one of the reports, aiming to finish at 1 o'clock. So without any further ado, I'd like to introduce to you Dr. Sara McFall, who is going to take us through these reports. Sara, over to you.
Thanks, Tim. Kia ora. Koto, thank you so much for joining this call. As Tim said, I'm going to start off talking about the Network Environmental Performance Report, or NEPR for short, and then we'll pause and have some questions. The first thing I want to do, though, is to thank all of the suppliers and network operators who have submitted the information that enables us to provide this report. It's really important that we can give the public a national level view of water services, and so we couldn't do that without the information that's provided by people on this call. And the other big thank you is to the team who have put in an enormous amount of work in producing these reports. As Tim mentioned, there's a lot that goes into producing them, and we're really grateful for all of that work. And we have quite a few of them on the call today, and they are the real experts on the content and will be available to answer some of your more detailed questions. So we've got Bella, Heather and Charlene, who are the authors of the reports, and we have Ed, Molly, India, who are the real technical experts who have analysed all of the data and will be able to talk with much more ease than I can about some of the detail that sits in the data. They are on the call, and when we get to the Q&A, I'm sure they'll be able to answer your questions. So if we start with our NEPR for 2023-24. So this summarises the information that's been provided to the authority from network operators about the performance of public drinking water, wastewater and stormwater networks. And it shines a light on how the operators are performing, providing some insights from best practice, and also looks at areas for improvement. So we compile the report based on a series of measures that you will probably be quite familiar with, and they look at the impact on environmental and public health, impact of the performance of the networks, and that looks at different things, so about efficiency and reliability, resilience and economic sustainability. This is our second report, and we have many more measures and much more information this year than we did last year. So we've got about twice the information on drinking water, and for the first time this year, we're reporting on some wastewater data. What you may have seen is that on stormwater, we've provided some general information and some case studies, but at the moment we haven't consulted with the sector on any measures for stormwater. And so the focus of this report is much more on drinking water and wastewater this year. So what have we seen this year? So we have a much clearer picture of performance this year. So last year was our first year, and we found that there was quite a lot of inconsistency, variability in the quality of the data that had been provided to us. And so it limited the kinds of conclusions that we could really draw from the data. This year, we received much more data and much better data, covering about 120 different performance measures. And it's allowed us to draw much clearer findings from the data that we have. So I think it's telling quite an interesting story this year. We've also seen some really good improvements in the data that's been reported to us. You'll see here some stats at the top of the slide. So 26% more pipes have been graded this year to determine their condition. 14% more network operators have assessed the risks to their critical assets, and 7% more network operators have a water conservation plan in place. So that is really promising to see, really encouraging. We're still quite concerned about other aspects of data and some of the reliability. And for some things, we receive quite low reporting, even though they're on things that we would expect operators to have information about. And you'll see some of the examples there. We also did something a bit different this year in that we conducted an external review on some of the data reported to us, and we focused on water loss and asset condition and looked at a subset of network operators in a lot more detail. And that showed that about half of the operators had some problems with data on asset condition and water loss. And we were able to dig a bit deeper into some of these problems with those operators. And we found a variety of issues, but some of it really came down to, particularly for some smaller suppliers and smaller councils, where there were, fewer resources in terms of staffing and systems to be able to monitor their systems and networks well and provide that information. So we have drawn that out quite a bit in the report this year, and called out where we think, some of these problems are down to insufficient funding and resources and the capacity to carry out assessments. But also acknowledging that on our end, there's a need for us to continue to simplify and clarify our expectations and work with network operators on the information being provided to us. So if we carry on talking about water loss and asset condition as the kind of key measures we really focused on for this year's report, we found that poorly maintained networks can be very wasteful. This has implications for people, for consumers, and potentially having to pay more for their rates. Implications for operators, and there's also a risk, a public health risk, obviously, as the more water coming out of pipes means the more risk there is of pathogens getting into the pipes, which has a public health risk for communities. We looked overseas and found some evidence of this, that 30% of outbreaks overseas have been linked to poorly maintained networks. So it is a really important thing for us all to focus on. We got some good information about the grading of pipes. And as I said before, more have been graded this year. But we found that a lot of those pipes are in really poor condition. So 16% of pipes were graded in poor condition. We also found that 32% of network operators reported the worst possible rating for water loss. 11% were operating below their own reference levels for pressure. So you'll see here on this map, it's possibly quite hard to see here, but you'll be able to see it in the report as well, that this is showing the infrastructure leakage index rating. and the red dots show where the networks received the worst possible rating, which is a rating above 8. And 32% of network operators had at least one of these, indicating an inefficient network with poor maintenance and poor asset condition. One of the other things we found here is that some of the data was presumably an error, as we got some really, really high or really, really low numbers, which probably indicates that it was calculated wrong or there was an error there, and that accounts for about 8% of network operators. So important to call out in the reports. Obviously, if operators don't have a good understanding of their networks, the condition of their assets, where water loss is occurring and the extent of the water loss, it's much harder to prioritise infrastructure investment and funding for upgrades, to manage risks to the environment and public health, making sure that our drinking water is safe for consumers after it leaves the treatment plant and is travelling through the pipes. So this is the first year that we have collected any financial data from network operators. And you'll see here it showed us something that may not be surprising, but is quite important, quite interesting, about the rate of spending between rural and urban councils. And you'll see that rural councils have been found to be spending twice as much. And obviously, this reflects a very the kind of geography of New Zealand. We have a dispersed population over often very difficult terrain. We've got a very high number of drinking water networks per person, and this is particularly the case in rural areas. And this obviously has important consequences for councils and for ratepayers, as there are fewer people in rural areas contributing through their rates to maintain the same amount of infrastructure in an urban setting, or even more with the very dispersed networks. For example, one drinking water plant serves 19 times as many people in an urban area or as a rural area. So this is a really challenging situation for rural councils to be facing. There are fewer resources, managing very challenging networks. So that was something we thought was worth calling out in our report this year. One of the other things that we have talked about this year, which is a bit different to last year, is about water use and the increase of that overall. You'll see the numbers there, 60% of operators using more water overall, leading to a 12% increase in the volume of use. However, you'll see that called out in that blue box. A really big driver of this was Cyclone Gabrielle, which hit during this time. And it led to one council, so Wairua, increasing its water use by 11 times. And so obviously it's hard to draw any conclusions or a trend from this, but we thought it was worth calling out over time as we continue to do this reporting. We'll be able to see if there's more of a trend there. We would expect with climate change or climate differences that each year will look a bit different. But it's something that we think we need to keep an eye on, because obviously the more water that's used, particularly when you're that's on top of water loss, it risks quite a lot of wastage, which is, not something we would want to see on an ongoing basis. So talking about extracting water, this was another thing that was new this year, that we had information about consents, particularly around water take. I think this was one of the really interesting things in this year's report. And you will see that we found that 44% of water take consents are due to expire in the next 10 years. 9% are already expired. And while we know that operators can continue to operate under Section 124 of the Resource Management Act, we found that some suppliers are operating on consents that have been expired for more than 10 years. We also heard from operators that they were not always meeting their consent conditions. So 27 operators reported to us that they were not meeting their consent conditions for the rate or volume of water abstracted, and that accounted for 11% of all water take consents. So this means that operators are at times either taking more water than is permitted or at a faster rate, or potentially both. Again, we don't have consistent data on the degree or how often consents have been exceeded, and that could vary a lot between different operators, from something quite minor to something more serious. And in future years, we might look into this a bit more. But for our first year, this is the information that we have highlighted in the report, and I think it tells quite an interesting story. So another first this year is, this is our first set of information about wastewater. And we reported on some of the consent information on that as well. And we also looked at the different levels of wastewater treatment and how it varies across the country between different types of operators. So you'll see here we've broken it down by primary, secondary, tertiary treatment across different types of operators, so rural, provincial, and metro. And you'll see that 40% of rural and provincial wastewater received the highest levels of treatment, compared to 75% in urban areas. Obviously, you would expect urban areas to have higher levels of treatment where you have large populations, and it can be horses for courses and what is expected and what is safe. But we found it quite interesting that in some of the provincial and metro that there were lower levels of treatment for wastewater. Excuse me. And similar story to water take consents. We know that a large number of wastewater consents are due to expire within the next 10 years, and many have already expired. And we've talked about this quite a bit, and many of you on the call may have been across some of our consultation on the wastewater performance standards, which we consulted on a draft of those earlier this year, and we're expecting to have new standards come in later this year. And we found through that work that we were looking at a bow wave of wastewater consents that were due to expire, many operating on expired consents. And again, like the water take ones, there are some there, 13, that have been expired for more than 10 years. We found that rural and provincial councils were more likely to have an expired consent or be operating under Section 124 of the Resource Management Act. And we know that it is challenging in rural areas with a smaller population to go through the costly reconsenting process and to invest in upgrades to wastewater treatment plants. The intention of the wastewater performance standards when they come in will be to provide certainty to councils on what's expected, and also reduce some of the cost and time in doing that consenting process. So we hope to be able to report in the next few years on quite a change in this space in terms of consents being put in place. So carrying on with wastewater, another thing we looked at this year was overflows. So this is overflows of untreated wastewater directly into the environment. This is a common occurrence, often taking place at beaches, and we'll know that you get quite a lot of reporting in the press about not being able to swim at beaches or gather seafood. Obviously, you can't avoid overflows, and it will happen when there's high rainfall or a blockage or a problem with a plant, or particularly where you have stormwater and wastewater pipes that are connected. That said, we found that overflows are not well monitored or managed. We asked operators how overflows were controlled in their regions and found that many are unconsented or unmonitored. Often this is due to rules in regional plans. You'll see that the most common response is for overflows to be a prohibited activity, which means that consents are not needed. But this means that there are very limited requirements on monitoring and reporting on overflows. And this, again, is something that we're looking to address in the upcoming wastewater performance standards, where we will be looking particularly at what can be done to improve monitoring and reporting for overflows. In terms of the reporting that's taking place, we found that 30% of councils are using verbal reports as the only type of monitoring, with very fewer than half, reporting to us that they use any kind of real-time systems. So what does that tell us in terms of a sort of overall picture? I think it won't be surprising to anyone on this call that the report confirms that we have a really critical infrastructure challenge at the moment in New Zealand. The cost of infrastructure is one of the biggest investments that will be made by an operator. And we saw a lot of issues with asset condition and loss and inefficiency, so treating and pumping water that doesn't reach the end customer, excessive water loss, combined with some of those water take demands and overuse. And as I said before, this actually has quite significant public health risk, with leakages in pipes, meaning that pathogens can get into the pipes. So we are quite concerned about the picture that this report is painting. Obviously, as we see the effects of climate change, along with the risks of water shortages, high water loss might affect the ability for regions to develop and grow. And the longer it takes to invest in improving the networks, the more that we see the cost and risk increasing over time. And as we talked about before, we saw a real difference in the resourcing and capacity between urban and rural networks, so we saw a particular challenge for those small rural councils in facing these infrastructure challenges and dealing with the networks that they have. So we've made some recommendations and we've taken on some commitments for ourselves. And we've shared them here. For us, we acknowledge that providing data to us is a lot of hard work, and we want to make that process as simple and clear as possible. So we are looking to continue to improve how we do this. We're also going to be working alongside Commerce Commission as they set up their information disclosure process and measures to make sure that we are minimising the impact and duplication on the sector. For operators, providing good quality data is important for us, important for providing that to the public and giving them that national level view, but also very important to understand your own network so that you can make smart investment and look to where you need to make upgrades over time and make sure that we have a really resilient network for the future. And we are this time talking to regional councils as well, particularly as we look at those the consent data that we got for drinking water and wastewater, and looking at overflows as one example of something that we think really needs some attention. I think I am pausing there.
I think you are pausing there, and at this stage we were going to pause the discussion in order to take the many questions that we were anticipating on the network environmental performance report, but we actually have none. So a reminder to participants, if you do have any questions, please pop it in the Q&A. The chat's disabled, but the Q&A, we would love to hear any questions that you do have. But Sara, I'm afraid your break was quite short because we'll just move on now and have a look at the drinking water regulation report.
Okay, so our second report we're going to talk about today, the DWRR for short, Drinking Water Regulation Report. This is the fourth time we've produced this report, or third and a half, I think. And this reports on calendar year, so 1st of January to 31st of December 2024. This one is really about the quality and safety of drinking water supplies. And while it might look and feel similar to that other report, for some reason, I'm not sure about, this one gets tabled in Parliament and has a slightly different statutory process, but largely the same. And we have produced both of them at the same time, so you get that sort of overall story of our water services. So quite a bit of good news in this report, if we go to the next slide. So quite a lot of progress this year. If you look at the calendar year, we're reporting on 3.85 million New Zealanders with access to safer drinking water. So that's drinking water that has those critical safety barriers in place, so protozoa and bacterial barriers. And actually, since the end of last year, many more council supplies have put in place those critical barriers. And so we're now looking at about 4 million people who have access to drinking water with barriers in place, out of 4.4 million people who are served by registered drinking water supplies. So those are the ones that we have the data about and are able to report on. And it won't be a surprise to anyone to know that having protozoa and bacterial barriers in place substantially reduces the risk of waterborne illnesses, prevents those kind of low-level illnesses that probably don't get reported, that don't turn into sort of Havelock North, but give people confidence that they can turn on the tap and drink their water safely. So that, I think, is the real call out from this report. The other thing that is a real shift from last year is the reporting on the drinking water rules, quality assurance rules. So 90% of councils reported on the rules by the due date. So that is a huge increase, and we are really grateful to councils for putting in the effort to do that. It provides a really important source of information for us. It helps us target our compliance monitoring and enforcement activities and provide that picture to the public. So really important, gives us confidence that suppliers are managing the safety and quality of their supplies. We saw the biggest improvement this year from rural councils, which was great, and also high levels of reporting from some of our Crown supplies, so Department of Corrections and NZDF. And you'll see there's some other improvements this year, more suppliers having drinking water safety plans, which means that they are managing the risks to their own supplies. And the other number is the number since December of additional people, by December, with additional people access to water with treatment barriers. So that's the good news. Some of the areas where we still need focus. In some places, we found that treatment barriers either have not been installed still, or that they're not being operated or maintained properly. So we have an expectation to all those who do not have the basic treatment in place to have that in place by the end of the year. And so we should be able to report on that for next year's report. But we would also expect that those barriers are being maintained properly and that we're not seeing detections of E. coli or other contaminants in supplies that have treatment in place. We expect an improvement in things like having not just the critical safety barriers, but backflow prevention. So we don't want the undesired reversal of water flow, because that introduces contaminated water back into the network, and appropriate storage practices. So those are some of the things that we call out as work-ons for next year. So you'll see there some of the things we found this year that were still concerning to us. And in particular, that is the number of E. coli detections. And you'll see later in the report and later on that we've got a map that shows that we're still seeing too many reports of E. coli, particularly in rural areas and particularly in rural schools. So here you see, and hopefully you can see the colours there, which breaks down the type of supply and the E. coli exceedances. So while the number was down from last year, so 220 in total, it's still a concerningly high number. This is an indicator of pathogens in the drinking water, and it poses a real risk of infectious disease. We would expect any detection of E. coli to be taken seriously, and actions to be taken to protect public health as soon as they are identified. So while I mentioned before, we had this more frequent detections were from rural supplies. We did still get E. coli notifications from urban council supplies, including some councils with the required treatment barriers in place. So that is telling us that the treatment barriers are not being properly maintained, or there's a problem there. So one of the other things we found was that E. coli is detected in all source waters, and that includes deep bores. So this is something that we talked about last year. We've talked about it this year, and by next year, we're really hoping we'll see a significant improvement on this. Noting that in addition to expecting, big councils to have big centralized, proper centralized treatment and all the barriers in place, we are looking at practical solutions for smaller councils, as we acknowledge that putting in place treatment barriers is a costly investment. And so we are aware of that, and we are working with those smaller suppliers on alternative cost-effective technology that still allows them to provide safe drinking water to their communities. So as I mentioned before, one of the particular aspects of the E. coli notifications that was concerned this year was rural schools. You'll have probably seen that there was quite a lot of media about the situation with schools when we published the reports. There are quite a number of schools, so about 400 schools, that supply their own drinking water, and they are often in quite rural and remote areas. In fact, 19% of schools supply their own water. And we found that of all our E. coli notifications, nearly 60% of those were from self-supply schools. So that's 71 schools, and you'll see there that 24 were repeat exceedances. And you can see on the map there that these are largely in the North Island, but they are quite spread around. So this is obviously really concerning, and we've been working really actively with rural schools and the Ministry of Education to take rapid action. We have seen some improvements this year, and we expect by next year that this will look significantly different. We understand the Ministry of Education is taking this very seriously and putting in place some plans to address the situation and put treatment in place within the next 12 months. So we're encouraged by that and hope that we won't be publishing a map that looks like this next year. So the other area that we report on are chemical exceedances, and hopefully you can see there that the different bubbles look at the different chemical exceedances and the notifications we got this year. So the numbers were slightly increased. And you can see the different size bubbles about the different issues that we picked up. So one of the main things was the arsenic exceedance in the Waikato. You will have probably seen that in the news, and we continue to receive notifications of arsenic exceeding the maximum acceptable value, the MAV, in some of Taupō District Council's supplies. And I know that there's a programme of work underway to address this. Other areas we received notifications on were disinfection byproducts. So that's aluminium and Clutha, and chlorate and Hastings. Again, we're working with those councils, and we know that there are plans in place. We also had a report of elevated levels of nitrates in some of the areas, including the Waiho catchment, which is a Waimate district catchment. And some exceedances related to lead were reported, although that looks like it was more about the sampling methodology to do with the taps rather than the drinking water itself. So something that we keep an active look on, it's something that's of real interest to our minister, are consumer advisories, particularly the long-term consumer advisories. So obviously, as a short-term safety measure, we would expect these to be used as and when is needed, a do not drink or a boil water notice to manage short-term safety issue. However, we are also tracking long-term advisories, some of which, as you can see there, been going on for many years. So 20 council supplies have advisories that have been going on for 3 years. So we know that there are a series of issues that will sit behind why any of these long-term advisories are in place. But we will be working hard this year to look at what can be done to implement permanent solutions, with a pragmatic acknowledgement that there may well be significant capacity issues or funding issues that sit behind these, but a focus for us over the next year. So a bit more on the prolonged use of advisories. So you'll see that 93 were in place before 2024 and 20 were initiated in 2024. Some of these have been closed. Some have been dealt with through a general exemption with DOC, but we still have 74 at the end of the year. And so the concern is that we have consumers are at risk of drinking unsafe water, and people over time not wanting to keep on boiling their water and stopping putting basic safety measures in place. So something concerning and something we'll continue to work on. And I guess a bit of a plug for how we're going to focus on what we found in terms of those consumer advisories. So we have just published our compliance monitoring and enforcement strategy, and that shows how we are going to address the risks we have identified in the DWRR. It's really that focus on getting those basics in place. So where there aren't treatment barriers in place, getting those in place, where they are in place, making sure they're working effectively. Where there are long-term advisories, what can be done to implement a change so that we can end those long-term advisories, and over time make sure more and more people have access to safe drinking water. So this sets out our plan over the next 3 years for how we will be working with suppliers to really address what we've seen in last year's report, so that when we come to talk to you about it next year, our map is looking less colourful and we have way fewer of those exceedances and concerning results. And that
is that. Well, for this part of it, thank you very much, Sara, and well done for a 40-minute monologue. Not easy. We do have a couple of questions, though, coming from Daniel Pickup in my old hometown, or the home district of Clutha. Firstly, on the drinking water regulation report, were the numbers from late December 2023 pulled into 2024 reporting because of the Hini Korako entry being made in 2024?
Oh my God, that is a good question and very detailed. And I don't want to put anyone on the spot, but Molly, do you know the answer to that one? Or does anyone on the call know the answer to that one?
I can sort of speak to it a little bit. My understanding is there has been a bit of offline conversation around this, and our data team, Pervy and our data analytics team, has been responding to it via operations. Yeah, I think if there were anyone to actually, I'd probably not be the right person to speak to it from a technically detailed level. If anyone was, it would be Noah. Otherwise, we can pick this up offline with you, Daniel.
Yeah, we can come back to you, Daniel, if we can't answer that one straight away.
And the second question from Daniel also, self-reported MAV exceedances may have been missed by only relying on laboratory notifications.
Again, on this one, I actually think in the report we do use self-reported notifications, and we comment on the data around that within the report. However, in the Clusa case study, we perhaps if Charlene could comment as to whether we've used self-reported in that particular case study. Charlene, are you able to help?
Yes, kia ora koutou. So I'm Charlene Maslin, Policy Advisor. So the report for MAB exceedances does focus on accredited laboratory notifications. So that's what we kind of, when we do our breakdown of data and comparisons between the years, that's the data that we are drawing on rather than supplier notifications. And part of the reason for that is there's kind of quite a discrepancy in the number of supplier notifications we receive versus laboratory, with laboratory notifications being a lot higher than supplier notifications. But one thing we do in the report this year in the appendix is that we call out supplier notifications of MAV exceedances where there's been no laboratory notification. So that's something we've done this year, just where that situation comes up where there's potential for self-reported supplier MAV exceedances to be missed.
Excellent. Thank you. I hope that helps, Daniel, and certainly someone will be getting back to you for the details on that first question. Well, I've just double checked and there's no further questions from anybody. So I guess we've all given each other, oh, here we go, just in the nick of time, one from Deborah. I note that only 533 of community supplies are registered. The estimate is around 75,000. Yes. How are we working on getting these registered and what do you think these will do to the data? That is a very good question, Deborah, and I'm going to pass it over to Sara.
Oh, thanks. Yep, that's a very good call out. So depending on what happens with the latest piece of legislation that has just been reported back to the House, the Local Government Water Services Act, you'll see there are some changes that, one, extend the timeline for community supplies to register with us. So that pushes out that date slightly. And the other thing is some changes around supplies of under 25 people when they are not a sort of community supply. So if you are a sort of, small farm network, you may not be needing to register with this, but obviously the bill is still before the House, so we're not sure exactly what it will look like, but that is what is in the reported back version that was available a couple of weeks ago. But what will it mean for our data? Once all of those are in, I expect it will really provide such a different range of, challenges when you're looking at very small community supplies. So I think it is going to really broaden out that picture of what the whole of New Zealand looks like, as opposed to largely council supplies and then a small number of private and community supplies and government supplies. So I think within the next few years, it will look quite different, but I think we're a couple of years off seeing anything for the time being.
It's a constant source of conversation to us here, how we're going to penetrate into those smaller, much smaller supplies. has continued with the domestic shed supplies are clear, it is not businesses. So I'll be interested to see how that affects farm supplies when the water is also feeding the smoko room and the dairy shed.
Yeah, I know there's been some discussion about all of those definitions, so we'll see where that gets to.
You have to watch the space, yes. It's that balance between is it really working as a business, or do you know everybody who's in the dairy shed every day? All right. On that basis, thank you to Daniel and Deborah for those questions, and thank you to everyone else who has joined in. Thank you to Sara for your presentation today, and for everyone who's done the background mahi to make the slides and to make everything happen, and to members of the Taumata Arowai team who joined in to help with the answers to those questions. We do have two more webinars coming up on these reports. They're going to be a bit more technically focused, and they are next Wednesday, the 23rd, and Thursday, the 24th, again at noon, so people can join in at their lunchtime. So if you're talking to your friends and colleagues and say that you joined this and found it useful, which we hope you have, and that you will, do please encourage them to join in, or join in yourself Wednesday or Thursday next week, but at noon, 12 till 1. But without any further ado, with no further questions coming up, I'll just thank you all again for joining in, and thank our presenters, and look forward to catching up with you all at some future date. Ngā mihi nui. Thank you very much.
Thanks, Tim. Thanks, everyone.